Treatment of urethral neuroses. The neuroses due to chronic prostatitis and seminal vesiculitis may or may not be post-gonorrheal, as has already been suggested. Yet they are often attributed to gonorrhea by the patient and are, therefore, considered under this aspect. They may be divided into three groups: sexual neuroses, painful neuroses, sexual neurasthenia. To these may be added, for the sake of convenience, prostatorrhea, spermatorrhea. In order properly to treat these various conditions, an accurate diagnosis is necessary as to the presence of complications. If gonococci are present, one must first get rid of these by appropriate measures. If the prostate and vesicles are markedly inflamed, these must be massaged until the amount of pus expressed is reduced to a minimum. If there is stricture, this must be dilated. If there is residual urine without any other pathological cause, this may be set down to the sclerosis of the prostatic glands about the bladder neck, and is best treated by incision with the galvanocautery, page 746. If the urethra is hyperesthetic, this oversensitiveness must be dulled by the gentle passage of sounds as large as the patient can bear. The proper treatment for pain is the treatment which strikes the painful spot. Thus, if pressure upon the prostate or upon the vesicle excites a discomfort which the patient recognizes as that from which he suffers, massage of these organs will relieve this discomfort. If the passage of a sound strikes the painful spot, sounds are likely to cure. If touching the verumontanum with a swab introduced through the posterior urethroscope excites the pain, this is likely to prove the proper point of attack. In these cases, above all others, care should be taken not to persist too long in any one course of treatment with blind insistence that this treatment must cure. Unless the progress of the case is entirely satisfactory, no given course of treatment should be persisted in for more than 3 weeks. Finally, so many of these difficulties depend entirely upon sexual irregularities and derangements that the patient's sexual habits, both previous and present, should be intimately investigated, and every effort made to lead him to as clean, as wholesome, and as normal a sexual condition as it is possible for him to attain. Although matrimony cannot be prescribed like a pill, and although these patients are often sorry subjects to place on any woman's hands, truly happy married life is often the only real remedy for the patient's condition, and unfortunately, almost as often it is a remedy beyond the patient's reach. But the great majority of urethral neuroses are due to inflammation in and about the verumontanum and utricle. Treatment of the verumontanum and utricle. The urethroscopic treatment of these lesions is described on page 204. We may summarize the status of treatment as follows. The sexual element is all important. Moral control of the patient is more essential than physical treatment. Mild measures may succeed where severe ones fail. 2 drops of 10% silver nitrate solution can be placed quite as accurately upon the verumontanum by the instillator as by the urethroscope. If installations fail, the urethroscope may succeed, both by revealing lesions and by permitting more severe cauterization.